We are live. Let me find the agenda. What? Oh, thank you. Lunch. And we are starting today. We started out with a light agenda. We have H 237. As we work through this week, I'm just gonna take up the H bills as they come in. These have been sitting here for a while. We're gonna just walk through with staff and then we'll decide what we want to take up and what we want to take it up. So we're going to start with H 237, act relating to prescribing by doctoral level psychologists. This went through health and welfare. I actually thought it was an S bill, but apparently it went there last year, it came back this year. So we now have it. And Nolan is working on a tight schedule, and he said he has one of the shortest fiscal reports. So we'll hear from him and then spend more time with Katie going through the bill.
Great. For the record, Nolan Langlow, fiscal. The fiscal note is 3 sentences, 3 paragraphs, 3 sentences.
Wow.
There actually was not a fiscal note until this morning when the other day Charlotte said, "Can you come testify on this bill?" And I was like, "What bill?" And I looked it up, talked to OPR, and I was like, "Oh, it should have a fiscal note." So I got this far. But although the word de minimis or de maximis, neither of which are in the fiscal note anywhere, that is the effect. So I would like Katie to talk about the specifics of it.
Yeah.
But the bill proposes to authorize prescribing by doctor level psychologists. So I reached out to OPR and said, "What's the impact?" And so they said for psychologists looking to obtain prescribing specialty, there would be required to pay a $100 fee upon initial application for the specialty. And then there are no actual renewal fees after that. So there would be some people who would apply, maybe make a few $100, maybe, it's not gonna be a lot of money. And then on the appropriation, there's no appropriation in the bill. They do anticipate there to be some startup costs, maybe as much as $4,000, which is de minimis, and can be covered within their existing funding.
Did this go through health and welfare?
Yeah. Yes.
Oh, it did. She just said that. I'm sorry.
But I missed that too. This is the first one testifying on.
And I voted no. So
I voted yes, and I'm reporting the bill, so that's helpful. Thank you.
Senator Chipman, you're.
There's a direct legal antonym of de minimis and de maximis, but in the practical sense, it's actually the term material versus de minimis.
Ban college professors.
So would it
I
be,
know.
would the word immaterial be the equivalent?
Statistics.
Would immaterial be the synonym of de minimis?
It's a good question. I'm gonna Google that.
Okay.
And what was the square something that Senator Watson was asking
The
about?
deviation or the upper quartile, and can be a better way to observe the existential threshold, but this was the conversation towards the lines of the room where you're talking.
German.
We were talking about non-de minimis, so.
Yeah, I could start getting into the hypotenuse theory.
Okay. That's why we have staff to explain these things to us.
You didn't explain it to me. I
The
didn't know.
word is de minimis.
Immaterial.
For immaterial. It's about $4,000 to set it up. Assuming that there are problems that we might change or request at some point
They're not asking for appropriation at this
at
time.
this time.
It
Yeah.
can be fulfilled within their existing fund, special.
Right.
They got too much money.
No, well, minimus, and it becomes around it, you have sometimes you.
Immaterial.
It is
We're gonna
the
go.
beginning, not the end of the week.
You know, those
Okay.
reactions.
We have had one more times.
You're trying to come up with a cool word today.
Okay. Thank you, Noel.
Thank you for having me early. I appreciate it.
Okay. Okay, Katie, I was really put track of this back and forth. But we just noticed this day. Good afternoon. Good afternoon.
Katie McLaren, the Legislative Council. Okay. So we're looking at H 237. This is prescribing by a doctoral level psychologist. As the name implies, this would allow individuals who are already licensed by OPR as psychologists and who are operating at a doctoral level would be able to prescribe. The way they would prescribe is with a collaborating relationship. So they would work with, or I don't want to say under, but they would collaborate with a psychiatrist and they'd be able to prescribe the same types of medications that the psychiatrist regularly prescribes. The collaborating agreement between the two would be filed with the board of psychologists. And this would essentially be an extra specialty that a psychologist could have. So first in section 1, we have, we're in our chapter on psychologists in Title 26, and we are adding a definition, several definitions at the top of page 2. Collaborating practitioner, as I said, means a physician licensed to practice medicine for the specialty in psychiatry. There's a reference to DSM, the Diagnostic Statistical Manual for mental disorders. Prescribing psychologist means a licensed doctoral level psychologist who has undergone specialized training, has passed an examination, as determined by rule, and has received current prescribing specialty pursuant to a section that we haven't looked at yet. That has not been revoked or suspended by the board. Prescriptive authority, I'll skip down to that one. 17 means the authority to prescribe or discontinue prescription drugs solely for the purpose of diagnosing, treating, or managing a condition recognized in the DSM. Prescriptive authority excludes the authority to dispense, administer, distribute prescription drugs, prescribe or discontinue prescription drugs for patients who are less than 18 years of age or over 80 years of age or pregnant. And then we move to section 2. This is powers and duties of the board of psychologists. So there's some changes here. Right now, one of the duties, this is the rulemaking. So the board has the authority to adopt rules, including rules that. So in subdivision 2, currently rulemaking on explaining complaint and appeal procedures to licensees, applicants, and the public. That is struck out, and there is new language around regulating prescribing psychologist licensees, the setting of clinical rotations, and prescriptive authority, including designation of conditions and drugs excluded from the authority, as well as the requirement for the prescribing of particular drugs. And also regulating collaborative practice agreements pursuant to this section on the specialty that we haven't looked at yet. Including collaborating practitioner qualifications and competency evaluations. So we get to section 4. This is the new section in the chapter on psychologists that all the other language keeps cross-referencing to. So this first in subsection A sets out the authority or the specialty that a psychologist doctorate can apply to the board for the specialty. The application shall be made in a manner approved by the board, including the payment of any required fees. And subsection B, specialty by an examination. The psychologist doctorate is eligible for the prescribing specialty if that person holds a current license to practice psychology at a doctoral level, successfully completed a postdoctoral training program in psychopharmacology designated by the American Psychological Association or successor, has completed clinical rotations over a total of not less than 14 months and not less than 9 practice settings, including psychiatry, pediatrics, geriatrics, family medicine, internal medicine, emergency medicine, obstetrics and gynecology, surgery, and 1 elective. Has completed a national certifying exam, meets other requirements required by rule. And then we have criteria for the prescribing of medication itself. So there has to be that collaborative written agreement between the psychologist and the psychiatrist. In subdivision 2, issuing The issuance of prescriptive authority by the collaborating practitioner to a prescribing psychologist shall only include prescription drugs for the treatment of mental health conditions that the collaborating practitioner generally provides to patients in the normal course of practice. The collaborating practitioner is filing that collaborative agreement with the board. Issuance of prescribing authority for Schedule 2 through 5 controlled substances shall identify the specific controlled substance by brand name or generic name. And prescription or administration of a controlled substance by injection is not allowed under this section. And then we have the specialty by endorsement that the director may, upon payment of the required fee, grant a prescribing specialty without examination if the applicant holds an active psychologist prescribing authority in another US or Canadian jurisdiction. And at the top of page 6, the requirements for psychologist prescribing authority in that jurisdiction in the judgment of the director of OPR are substantially equivalent to the requirements in this section. In terms of effective dates. Oh, we never updated the effective dates. This section,
Oh, we did do that.
Katie, I also thought we added something about primary care providers. No?
I don't remember
Okay,
that.
I don't. Okay. Maybe I'm. That's another. Yeah.
Let me check my notes, but yeah, I'm surprised that we haven't caught this. So this came over last year. And so in theory, everything would be pushed back a year. So A would be July 1, 2026 and subsection B would be 2027. Let me just check my notes to make sure that wasn't. We had a doc.
Does your committee make changes to it, Marty? We made this small amendment. This is the as passed by the House version.
Yeah. Okay,
We did.
let me pull my files.
There was a note earlier in the presentation, which there was some age limitations in order to property under 18 and over 80, is that
Mhm.
right?
Yeah.
Could you, Dr. take a look at that?
I will. Do you mind if I pull up the
No, go ahead.
current version?
Yeah.
Take deep breaths.
No, this.
That was a
this
big
passed
yeah.
by
Let's just breathe it in. Breathing.
I don't know that we made any changes.
I thought we made some small changes. I'm not remembering a PCP though, but. Let me take another look.
Did we do section 4 a reporting, the OPR has to submit a report to health and welfare?
That was added in Senate.
Okay, yep. Effective dates are 7/1/26 and 7/1/29.
Oh, good. We did catch it.
Yeah. You're
Okay.
just looking at the
Oh,
wrong.
okay,
Yeah,
the wrong version.
No, you're the reporter, right?
yeah,
So you've got the notes from because what we had on our website is as passed by House.
yeah, that's not.
I'm sorry, I pulled it up quickly.
So Katie's gotta find,
I have it.
I don't know, how many bills did we put out that last
That,
day?
yeah.
Like 6?
A lot,
Why people might get confused about
yeah.
we're on version 22, 23.
I think you're being.
That was a marathon day for putting bills out and no short ones.
So this is draft 2.1 of
Okay.
health and welfare report, so I apologize. Trying to remember now where the changes were. I don't think there are any changes in the definitions. Where there were changes, this is the language you were referring to.
It excludes authority to,
So essentially, 18 to 79 is who the doctoral level prescribing psychologist can prescribe for unless the person is pregnant.
well, I just wanted to be, I understand a juvenile, I understand someone who's pregnant with a medical condition. What about where did over 80 come from?
I'm trying to remember. It wasn't discussed very much in Senate Health and Welfare. It must have come from House Healthcare last year. So I don't have, I haven't worked on it recently. I do feel like I remember that maybe there was a different age to start and they changed it, but I'd have to
Yeah,
look back.
one
at
of
my notes.
it's just an arbitrary construct.
I think they had a lower age to start with. don't quote me on that. I would have to go back and my notes, but I remember that there may have been a little bit of conversation on that piece last year.
I just have the over 80 bothers me, obviously, because I'm over 80. And why? I know a lot of people who are over 60 that I would say that ought to apply to.
Yeah,
It's arbitrary.
I don't know, because we didn't make that change in health and welfare.
yeah.
All I can say is we were trying to thread the needle between allowing this to happen and making sure that we.
I mean, if there's some cogent reason for doing it, I can understand. If there was some medical reason for doing it.
Okay,
I mean,
maybe,
pediatrics and geriatrics are two separate
Yeah.
areas
Yeah.
of study, and
but that doesn't usually start at 80. Geriatric starts
like 45.
55.
Oh my God. Yeah,
Well, we have Jen Colin coming in from the Office of Professional Regulation.
When you start doing things like you do with,
Yeah,
all
we can-
judges must retire at the age of 70. Well, why?
Yeah.
There's some judges at 60 who are senile, and there are others at 95 who are still on the bench.
some
and doing well.
seniors are super seniors.
Yeah.
They're super senior.
That just seems like arbitrary,
Define that.
unless there's some medical reason that someone can justify and document it with evidence
Maybe
as to
when
why
Jen
you do
comes
that.
in, we can ask her.
We can ask her and we can do further investigation and well, no, this is an age. We can sit on this
Oh,
until we find out.
I'll get you an answer on,
Yeah,
I'll get you an answer.
we should be able to
One way
get
or
an
another.
answer.
Can you just get testimony too?
But yeah,
The psychologists association or whatever. Yeah.
Well, presumably there ought to be some medical evidence that says that's a bona fide reason for doing that.
yes.
Sure there is. I don't think it was arbitrary, actually. We'll find out. Thank you. I'll be prepared for that question.
Okay, and the dates are fixed.
Yeah.
Okay.
So we're gonna look for questions about over 80.
What is different from what I just walked you through is, where we have the different, specialties. Oh, here it is. So this at the top of page 5 is completed clinical rotations over a total of not less than 14 months and not less than 5 practice areas, including psychiatry, geriatrics, family or internal medicine, emergency medicine, and neurology. So that is,
Now,
You
in
were
here you put
practicing.
geriatrics,
was it not in the other one?
Yeah.
This has
it was
changed.
but we
another one.
limited it to the age of 80, but you have to have a practice, 5 practice settings, which includes a geriatric practice setting.
And I think that was in the bill that came over from.
And but
We just-
pediatrics is not there.
Patrick's was in the other one.
No,
Yep.
it does talk about family medicine.
The
Mhm.
previous one, I think it said 9 practice areas, so
Mhm.
this list was shortened in Senate Health and Welfare.
Yeah,
So that was one of the changes, and then this reporting requirement was added by Senate Health and Welfare. So on our report, November 15th of 2032, OPR is to submit a written report to the policy committees regarding the number of psychologists with prescribing specialty, the status of available collaborative practitioners, and whether any updates to the qualifications of prescribing psychologists are necessary to expand access to care while also ensuring public protection. And then we have effective dates, which are happily updated to July 1/26, and the other one is July 1/29. So that was pushed out of it.
do you think we could strike the word written
Or written collaborative agreement or the report.
report?
Interpretive dance.
How many pages of reports did you have to go through? It took a whole day just to list the reports.
Sometimes for clarity, some committees say, shall present. So that it's clear it's not expected to be written. We could just strike written. It might still
I mean,
results in a written report, I'm not
if
sure.
we do this, we should be committing to check back in.
We can ask OPR, because it's an OPR report, so
Yes,
when Jen
that's
is here,
what we're doing.
let's ask her, if they might have their
It's
own,
only one, right? It's not a name.
we definitely need more reports.
We need more.
I love reports. I've been asked about them before.
I know. you-
Not that it's certification, it's somebody to read the report.
That,
One bill, it was 6 reports in
Not
that bill, it's like
Which one?
the one who didn't in this.
Oh.
that was a question
There
I
you go.
asked in committee when I was on screen. but I
Oh,
remember
that's
saying,
it.
"Oh, reports now."
And it got struck.
Yeah.
Okay, so we need to check on that. You're gonna do a practice setting with geriatrics, but you can't prescribe to anyone over 80. Why that is in there? We understand pediatrics. And why 80 is the cutoff date? If it's geriatrics, it should be 70 or 75 or I don't know. Maybe they're getting it mixed up with hospice. But we should clarify that. And we can ask, we can ask professional regulation what they want to do.
We can vote.
We do not have Jen Collin scheduled until 2:30.
Can I ask a question?
Yeah.
Is there anything in the bill that requires that if you're prescribing to a patient, that they have to be a patient that you're seeing for regular therapy? Or is it just?
I don't think it specifies that.
I don't remember seeing.
I know that that's one of the concerns by people I've heard from, that this will replace therapy.
Mhm.
Like psychologists are good at that. They're good at talk therapy or whatever, and that's what they do, but we let them prescribe and they wouldn't do that anymore. They would just prescribe. And not in every case, I'm not saying across the board, but that's.
There's a few psychologists are gonna get this. There's not many are gonna get this.
Section criteria, okay.
Yeah, don't know.
Well, it's pretty,
I would think, though, I voted against this because I wasn't comfortable. I want to make sure that psychologist they said, well, it's with a psychiatrist. But I don't know if a psychiatrist in private practice has access to UVMC's healthcare records. They're outside a network. I don't think they do, which means we wouldn't know
You have to request them.
all of the medications I might be on. And if you could prescribe for someone you're not seeing regularly, that is
Yeah.
not a regular patient, that opens up the potential for abuse. If somebody could just go in and you can prescribe. And these I was told by my local doctor that I have a lot of respect for. He did a lot of work with this committee, which will look at pharmaceutical regulation. That this would be Schedule 1 and 2 drugs. So that might be something to see if we can get some guardrails for.
Yeah, I mean, if we're gonna get testimony, you can ask those questions.
Right now, we've got LPR
Today or?
today, but then we can decide who else we would like to hear from.
I do want to just back to the question of how many people will actually get this certification or license. I think it's now in 7 states, but it may be up even higher than that. They're only actively about 300 to 350, although other data points say 225 to 250. And in the whole country, only 500 individuals have passed that examination, so it's not. I don't think it will be a huge uptake in the state of Vermont, but even if a few folks have access to it, it can really help, especially in rural areas where it's hard to find a provider. So we have a provider shortage, and this is one of the
Finding
problems. we're having.
psychiatrists in this state is difficult. Child psychiatrist is pretty close to impossible. But yeah, you'd have to have a psychiatrist who is willing to supervise several psychologists in order to put a dent in some of the backlog. Okay.
If you are looking for people to testify, I have somebody that reached out to me in Burlington who's a practitioner who has concern with this bill as well.
Okay, and we will hear from some of the advocates too, I'm sure.
Yeah. I don't know that we need to relitigate the whole thing.
No, I
It's
don't
just,
think we do.
it's just,
I
you know,
think,
get the answers to questions.
But if we miss something about welfare, we really need to look at it, yeah. Because this is another one, all you need is one thing to go wrong. And it will, somebody will get hurt.
Was the committee vote 4-1 or 3-2?
4-1. Right? I was the only no.
Yeah.
Okay. Okay, thank you, Katie. And
You're welcome.
Aaron can't get here in the 2:30. I mean, not Aaron, Jen.
I just sent a message out and I got
Okay.
a response.
We have penciled in, but maybe Senator Chittenden, there is an amendment floating around to the cannabis bill. That apparently somebody was supposed to introduce in economic development and failed, and I got told it Friday afternoon after we had left, or Thursday, whatever day we wrapped up. So Senator Chittenden is trying to see if it's possible. Have we been able to get a hold of Pepper?
No, I can reach out to him if you want him here at 3:00 also.
Yeah, we can get it. Because the cannabis bill's on the floor tomorrow, right? Okay. So we have got someone who's closing a property at 2, but can zoom in at 3. So we're trying to listen to this, so.
So this did already come up in our committee, but it was that really late day around 5:45 before we were trying to get out of here crossover week. This is a continuation of the discussion we had 1 year ago. This came up, it has to do with the fees we charge out for growers. We asked for a report from the Cannabis Control Board, and that is in it was posted, I want to say last Thursday. I'm looking at it now and I have it in front of me. But the Cannabis Control Board was looking at our an appropriation related to growing permits. I wasn't here when recreational marijuana was legalized, and I will have the impression though that this was an uncharted territory, and a lot of the fees were established based on expected thoughts, and not necessarily grounded in the actual yields or the cost to grow things. And so this has been advocated for, I want to say at least the last 2 years. But the amendment that is going to see before you, and that we have a grower, Sam Bellavance, who I believe is from Grand Isle, is going to testify to this. And it's also going to illustrate what's in the report that was on our committee page last Thursday, and maybe Charlotte's picking it up and putting it on today's. It's this right here, if that's possible. It just speaks to the fact that, again, I'm not necessarily advocating for this. I'm just trying to honor the requests that this does make sense, that growers, that this would only apply to people that grow marijuana outdoors entirely. This would not apply to indoor cultivators nor mixed use cultivators that use the combination. So this is just people that are tilling the soil. that are growing crops. And what my sense is, we have a lot of tax policies in the state to benefit and reward farmers that tend to the land. And so this, if you look at our fee structure, which is outlined in the amendment, it is pretty daunting to see how much we're charging people to grow stuff in using their land. And one of the arguments that motivated me to at least bring forward this discussion is that what other crop do we really charge people to be able to grow at these levels? I get that marijuana is different. It's a different type of topic. Cannabis. So all I'm saying is I think it is worth the conversation about recalibrating our outdoor growing fees in light of the very materially fact-based report from the Cannabis Control Board that indoor cultivators, which we're not touching those fees, they yield 4 to 6 times as much as outdoor growers. So their fees are fine as is. But when you think about it, an outdoor grower in Vermont has a pretty tough go at it. They get one season. If the frost comes too soon, it kills their buds. And if you look at these fees that we're charging, it's just, I would say it is disproportionate to what they can actually glean from the ground. And so I thought it would be worth bringing forward. To that end, since this originated in Senate Economic Development, Housing and General Affairs, I did have this discussion with them first on the premise that if they supported it, then I'd bring it here, and then I would bring it to appropriations. Senate Economic Development, we all signed on to it. So right now, this amendment has all 5 members of the Senate Economic Development Committee on board with it. But we recognize this would affect the revenues of the state, and to the tune of, since it's just outdoor growers, I have from an email, but not a fiscal note yet, between $100,000 and $120,000. We don't contemplate how to fill that hole. That's just left to be undecided, and that's why I wanted to bring it to these committees. One last thing I'd want to just put out there before I stop talking. It came up in committee. Right now, the amendment contemplates effective for next year, but it was suggested by some that maybe this might make more sense. And I look to those that have been serving longer than I, that if we are supportive of recalibrating, recognizing the tough go that outdoor growers have, we could push this out a year, and that might make the conversation a little bit easier for this. And that way, if we come back next year and want to push this out again, that could be another discussion. Did I miss anything, Senator Brock?
No, I think that's right. I think what we heard in economic development from quite a number of smaller growers, just indicating the difficulty they have in staying in business at this point. And the fee was significant in relation to that. I mean, I would prefer if we just went ahead and said, well, any vegetable we don't like beets, we'll put a fee of $100,000 on it too. And the question is, doesn't really make sense. It isn't fair.
To have any fee?
No, to have a fee that high compared to
Oh.
everything else.
This amendment still has fees. It just cuts
Yeah,
out.
it has fees, and the fees, obviously, there are additional costs associated with cannabis that don't exist with beets and asparagus and so on. We recognize that. And the fees are, though, still quite high in comparison. And it does appear, at least in the testimony we've heard, to have an adverse effect on people who are the smaller growers who we had intended with this bill and the fee structure to try to help.
Well, I have a question, but I don't want to, it's tangentially related, but let me let the fee conversation play out before I ask my questions.
Okay,
Because I don't want to stop.
we're gonna have to get someone to talk to us about the fees. That should be the Cannabis Control Board, so we've got an email out. He can be here at 3. He will be here at 3, okay? So, we will hear from them. And who would be joining?
Ted Barnett.
So Ted could be here to talk to us about cannabis around 3. We'll see if we can't take a look at this. Okay. We are out then, be back here about 5 minutes.
Do you want?
3.
Oh, perfect. Okay.
Oh,
Well, I think, let me ask Tom the
We have
question. I
something
think he might know
else.
the answer. We don't have to.
Yeah, Jeff,
break.
okay,
Okay.
all right. Be back at, oh, you're asking it now, all right.
No, go on break and then I'll ask Tom.
I thought we
Yeah, well,
did that.
I thought we
I
should-
know.
I mean, I'm willing to add, just
Wait, can I just clarify?
Yeah.
Because I thought we had a witness coming in at 2:30 on the other bill. The
Jen Collins.
Oh, Jen
Yeah.
Collins is here.
2:30.
So we need to be back at 2:30.
Okay,
Okay.
yes, we do
Sorry,
need to be
Scott, go
back
ahead.
at 2:30.
I mean, if you all want to listen to this, you don't have to.
Would you like to?
So-
Let's listen to the
I'm
question.
back to the delivery permit. Where it says that, this is for tier 1 and tier 2 cultivators. And I don't understand whether tier 1 and tier 2 means indoor or outdoor, but I think it means small. Small. So, and I noticed that the board is only gonna issue 15 of these delivery permits annually. So when my mind was thinking is if I've got a tier 1 grower out there that's small outdoors. And then I have another tier 1 grower that's small outdoors, but is also licensed as a retail establishment. As far as those 15 delivery permits, in my mind, and just my perspective, I would rather prioritize the person who's just a tier 1 grower. Because the retail person already has a way to sell their stuff.
I thought there was language in there that does that, that said
Well,
that.
I look back and I didn't see it, but maybe I'm misreading it.
Okay, I remember that Pepper said that it would be not, there was something about retail. If you're a retail person and you do delivery, you have to have like 2 people in the car. You have to have a car owned by the retail business.
But I think that's true for anybody, whether you're.
And that not very many people did it. This wouldn't change that. This would be for your
Yeah.
tier 1 that doesn't have retail. And wants to deliver to his 10 best customers on Friday night.
Right, but I'm thinking of like this. Like I've got farmers, they're small, they're tier 1, they have a little plot, and
Well,
all they can do right now is to sell it to a retailer at a wholesale
Right.
price. And what they want is a retail price. A way they can get the retail price is through delivery under this construct. However, there's only 15 permits annually. Should we, how would we prioritize that those people that are just our small tier 1, tier 2 farmers, that they are prioritized to receive these delivery permits?
let's talk
We have Pepper in here.
Pepper when he's coming in.
That's just kind of my thought.
And
Yeah. Did you talk about that in econ development?
We did, and I'm rereading the language now to see if it overlays that intent or that interest, and I'm not saying it yet, but if you have a chart, Chair Pepper.
Is that,
talk to Chair Pepper.
is that report that you were mentioning, is that done by the Cannabis Control Board? Okay, and are they recommending different fees in it?
He is ambivalent. I won't speak for him. I
Okay.
will say I recollect him saying
Okay.
ambivalence. on this.
Because my recollection of when we set the fee, it wasn't just random. We got a ton of testimony on the fees and they were
Okay,
reasons behind them all.
Page 8 is where he speaks to it as a consideration for the legislature.
okay, and the report has
Just to
been
attest to
posted.
everything. So, yeah, that's a lot of good.
But this would not be a committee amendment. This is right now an amendment with 5 senators' names on it, and if.
We don't have the bill, so we can't do it.
Is it-
Okay, everything is on the, it's on our website. You can read it. You have about 15 minutes left. And,
He wants to